Hey, hey. So I am going to be going live here in a minute with Brittany from Worthy to Live Therapy. I'm just going to add her in here right now. And this is going to be so good because Brittany works with pregnant and postpartum moms, and again, practice is called. Oh, there she is. Hello.
Hello.
How are you?
Good. Thanks for having
Good.
me on.
Yeah, thank you. I'm glad it worked out and was easy enough for you to get on.
Yes. Very simple. Very
Yeah,
simple.
good. Awesome. Well, so again, I'm Bridget and help moms heal after tough births. And Brittany, whenever I saw your page, I was like, this is so aligned and so great. So I was so happy that we could jump on a chat together. And hey, Sarah, no worries. And we're happy that you're here. So Brittany, why don't you just like give a little introduction about yourself?
Yeah. So, hi everyone. I'm Brittany Moffitt. I am a licensed clinical social worker in Maryland and Washington, D.C. I own the psychotherapy practice Worthy to Live Therapy. And essentially, I provide perinatal mental health services to moms. I'm also trained in childhood trauma. So, I do a lot of trauma work in my practice as well. Um, I've been in the mental health field for about 5 years now, and I am a mom of two boys who keep me very, very busy. I have a 3 year old and an 11th month old. Um, I'm also a NICU mama with my second son, and then I'm also a preeclampsia survivor for my both of my kids. So this topic of emotional triggers around birth stories is really dear to me professionally and personally. So thanks
Yeah,
for having me on.
yeah, for sure. And I didn't know that last part about being a NICU mom and preeclamptic. Wow, that's a lot, especially
Yes,
together.
yes, yes, yes. With my second, it was together. Yep.
Yeah, that is a lot.
Hmm.
Yeah, so again, we are going to be chatting all things understanding emotional triggers around birth stories. And so it's going to be really great to hear from your perspective because again, you work, this is like your specialty. So again, if you guys haven't checked out her website, it's just Worthy to Live Therapy for Pregnant and Postpartum Mothers, which is so, so great. So why don't we just dive in?
Yes.
So what are emotional triggers, first off?
Yes. So I think to know about emotional triggers, we first need to know about trauma. So I'll just back up just a step and say birth trauma is any physical or emotional distress that a person experienced either during or after childbirth. And that distress left that person feeling intense helplessness, made them feel out of control, made them feel quite powerless. If they had intense fear or horror during their birth or their labor experience, then that's birth trauma. Um, and it's important to note that trauma is in the eye of the beholder, right? So what's traumatic for me may not be traumatic for you. So it's a really individual experience. And so once we've experienced a trauma, then often we kind of go through life, right? Our day to day, and there may be times when we're triggered by that trauma. So there may be certain things that remind us of the birth. It may be, again, when we hear certain stories of someone else talking about their birth, it may trigger us to feel an emotional trigger. And an emotional trigger is basically like feeling intense rage or sadness and feeling grief, feeling those emotional reactions related to any reminders to the birth that that person experienced.
Yeah, no, that was all so great. And I love how you gave a little definition of birth trauma too, because I feel like a lot of times women that I work with, and I'm sure you work with, they probably try to brush it off almost. And it's like, oh, it wasn't that bad. Like, my baby's okay. Like, that's all that really matters. When in reality, that's not all that really matters. And
Yeah, yeah.
one other big piece too is that I've found, and like research has shown, that these traumas really, they're not just emotional, like they can show up physically as well. So I'm not sure if you have anything else to say around that, but that's something that I also work a lot with in terms of like releasing them out of your body.
Yes, that is so true. And I think the physical aspect is what people tend to notice. I think that's kind of what brings them into therapy, is kind of like, I
Yeah.
keep feeling this panic, right? Or I keep feeling like on edge, or I just feel like I want to run, like flee into the other room, like if someone brings up birth or if I have to talk about my birth. And I think the physical sensations are kind of what people notice, and it's like, this seems intense. It seems off, right? That I'm experiencing that. In the way that I like to talk too about, emotional triggers and trauma, is that if we've experienced, when we experience a trauma, right, that memory is stored in our brain differently than other memories that we have day to day. And so I like to explain it to my clients, like if you go to a restaurant, right, and it's just a casual, normal day in the restaurant, you may not remember a year later what you ate, what you wore, what you did, what you talked about during that visit to the restaurant, right? But if, God forbid, something traumatic happened while you were at that restaurant, then when you think back on that traumatic event, you're going to remember what you wore, you're going to remember what you ate, you're going to remember probably the entire night. And so I tell my clients that, because I have clients who come in saying, I gave birth 2 years ago, or I gave birth 5 years ago, 3 years ago. Like, why am I still triggered by this? Why am I still thinking about it? And it's because our nervous system doesn't know how to encode, those very intense, traumatic events, right? And so it gets stored differently. That makes us feel triggered by it either consciously or consciously, either emotionally or physically when it comes up.
Yeah, no, I love that analogy about, or metaphor, whatever it is, metaphor analogy, about being at the restaurant and like normally you wouldn't notice anything, but if something bad happens, then you definitely remember. And that's so true. And I really do think it's important to let women know too that like this is your brain trying to protect you
Yes.
by this happening, by like the way that you're experiencing it, is so that even though it might feel like it's working against you, it really is your brain trying to like protect you and to make sure that this doesn't happen again.
Yes.
Now, I'd love to touch on just a couple of examples of like what might be considered traumatic triggers for people. Some of the ones that come up with clients that I work with, especially if they gave birth in a hospital, are maybe the smell of what the hospital smells like. And then another big one is like that hospital gown. Do you have any others that might come up in your sessions?
Yes. So mine are more kind of emotional based. It's some of the common themes that I see for the emotional triggers is just that lack of care from the medical providers. Like the hospital can be a very disempowering place. So I know a lot of women who feel powerless. They felt abandoned maybe by the medical providers. They felt a lack of support, or they felt invisible. And so those are often from the like emotional, mental aspects that I see. And then also, like you mentioned, the hospital gown, and then, even avoiding going back to the hospital, right? Avoiding driving past the hospital where they gave birth, or often seeing the physical hospital is a trigger for some people, that send them right back into that memory. Um,
Yeah.
yeah.
Yeah, yeah, for sure.
Mhm.
I definitely get the driving past the hospital because I mean, my last two births have been at home, but every time I drive past the hospital where I had my other three, it's like I've worked through it all, so it's not like a like trigger or anything, but it's like I don't really like that place. That place. So
Yes.
it's very interesting how that does work. And then another big one, and you touched on this at the beginning, was the idea that women come in and say like my body was broken, or that things were done to me, or that it was out of my control, or like the bait and switch with the practitioner,
Yeah.
and just all. Yeah.
Yeah.
All right.
And just to add to that, these triggers also like around the birth story aspect. When someone is hearing someone else's birth story, they may start having thoughts of like, did I do something wrong to have experienced this birth, right? Did my body fail me, right? And then so they may avoid conversations even talking about the birth. And
Yeah.
especially during holiday seasons like this, right? There's a lot of people, you just had a baby. How was it? Tell me all about it, right? And then inside you're feeling like that, like probably pins and needles and that tenseness just falling all over because it is an emotional trigger that's happening in that moment, right? And like you said, it's the nervous system trying to protect you. It's trying to protect you from feeling that again. It's trying to protect you from, um, you know, it doesn't know the difference that you're not there now, right? So like it hasn't separated that yet. And so
Yeah.
when someone brings it up, it kind of sends you back to that moment, and it's like, nope, shut it down, go away, don't talk about it. So it
Yeah.
puts us right into survival response in that moment.
For sure. And funny enough, I just did a webinar today with Emanuela, who's on here. And so we did a little bit of like scripting where if somebody says in a holiday party, like, oh, how did it go? And you don't want to respond, like we kind of went through how you can respond to that in a way that really holds your boundaries firm and is still
Yeah.
polite. So, yeah. All right, cool. So we also wanted to talk about how trauma changes us. So I don't know if you can, like, we know that trauma rewires how we respond to stress, especially if it's like a true PTSD, which literally changes your brain and how it works, versus like a small t, little t or big T trauma is a little bit different. But we know, and I'm going to get a little bit in the weeds here, but like the amygdala is the brain's basically alarm system. So that can help us to become like hyperactive and perceiving even non-threatening situations as unsafe. So can you maybe like explain the impact of that trauma on the body and the brain a little bit?
Yeah. So good. So I'm a little bit of a science nerd when it comes to the nervous system. So I love talking about this.
Me
Yeah.
too.
So similar to what I talked about a little earlier, right? Like that trauma memory is getting stored in that different part of our brain. Like you talked about, like that survival part of our brain, the amygdala. And so it's going to have us do those four F's we've talked about, like that fight, flight, freeze, or fawn. And so when we experience a trauma, because it's stored in a different part of our brain, our logical part of our brain, like the prefrontal, right, cortex, like that area there is logged off. And so our ability to logically think our way through trauma or try to like, change our thoughts and things through that is very difficult to do because that prefrontal cortex is just completely logged off when it comes to the trauma. The trauma's not even stored there, which is why I tell a lot of my clients, if you were able to think your way through this, you would have done it. Like we are so intelligent, like human beings. If we could think our way out of trauma, we wouldn't need therapy, we wouldn't need all of the support that we need. So when it comes to what it does physically on the body, when we're in that survival fight response, flee response, it really limits our choices in that moment because, again, our body is all about protecting ourselves. And so when I think about the fight response, some women may feel intense rage when they think about their birth and when they begin to talk about their birth trauma. So that may activate that fight response there. The fleeing or flight response that shows up may be that avoidance that we talked about, where some women just completely do not want to talk about the birth trauma at all, right? They may avoid the hospital, avoid speaking about it with their partner, all of that. And then the freeze is that numbing, that shut down, that dissociation that happens, right? Where we're really detached from our body. We may even feel some detachment from our baby. It could even impact our ability to bond with our baby because we're dealing with unresolved birth trauma. And then the fawning. Some people don't realize that the fawning response happens sometimes right there in the hospital room when they're giving birth because I've had experience of working with clients where they may find themselves that they felt all they could do was say yes to the medical providers, right? Like they just said, they're like, I just could only say yes. And that's that fawn response, right? Like maybe the people pleasing comes in at that point because they're like, they're the experts. they know more than me. Let me just say yes to them. But then it really felt like a betrayal to our own wishes and our own autonomy that we have over our body, like in the birthing room. And so, a fawning is a response that happens too when it comes to the trauma responses that can happen within the nervous system. Hope that
Yeah,
answers
and I think a lot of
your
times,
question. Yeah.
yeah, for sure. And I think a lot of times women don't realize what fawning is. I know. Sorry, baby was wanting.
Oh,
Um,
hello. We love all the
I think
babies.
they don't realize what fawning is necessarily, and so it's just a good reminder that if you're not sure what fawning is, it's basically where you just kind of go along with it in order to feel safe and like to do what you feel is best for your baby in the moment. So it's I always like try to stress that it's literally a biological response, and you are a really good mom because you're fawning and because you're experiencing fawning, and there's nothing that you could do about it. Like that's just how our bodies are. And another thing that you were mentioning with the prefrontal cortex, how it basically turns off.
Mm-hmm.
That is why it is so important to have a good care team in place that you really trust, because when you go into that like active labor mode, your brain turns off and you really go into that primitive brain, and it's like just does what it needs to do. So if you're surrounded by a care team that knows your wishes and that you trust and everything like that, it's going to be a lot easier to have the birth that you want versus if you are with people that are convenient or just might like take the insurance and that's why you're doing it. So just like try to keep that in mind too for all the women who are listening to this.
Yeah, yeah. And I just want to add to that. That's such a good point, and to have a care team around you that knows what your wishes are, what your birth preferences are, and also to the women who feel like why can't I get over this? It's like a constant, it's something that I experience a lot with my clients of why can't I just get over this? It's again like that thinking part of our brain is completely like logged off. And so we need help to resolve this trauma, not just from the head, but from the heart and the body too. So in a whole approach, right? We have to connect the head, the body, and the heart to heal trauma. It doesn't just heal in our cognitions in our head.
Yeah, no, I love that so much. So you mentioned something in our little like pre-chat that we talked about where grief does not always mean trauma, but trauma always means grief. Maybe you expand on that a little bit.
Yes, yes, I love that quote. Yeah, so when we have experienced trauma, we've experienced loss. And in the context of birth trauma, there's losses attached to that. Often we come into birth and we have a plan. We have an idea of how things are going to go, which is one of the things I talk about with my clients is reframing the terminology around a birth plan and saying birth preferences instead. Because one thing that can feel really traumatic for a lot of women is when their birth plan deviates so far from what they actually experienced. And so losses can be attached to birth trauma, whether it's that we felt a loss of, again, our autonomy, right? Of our ability to make choices, if there was a loss there, if we felt like we were silenced and we've lost kind of our voice and being able to speak up for ourselves during our childbirth, if we lost, again, like our birth plan and how we expected things to be. If someone had an unexpected NICU experience, right, then they may have felt like they lost that golden and that hour, right? That hour of skin to skin. Some women don't have that. Their baby is just has to go straight to the NICU immediately, and that's a loss that's there. And so if we've experienced trauma, then we've experienced loss. And the reason I like to highlight that is because a lot of people don't know that aspect of trauma, that there is a grieving process that also goes with healing from trauma. We have to grieve what we didn't get to experience. We have to grieve, the emotional pain that we experienced in the birth that we had. And often that is a gateway into the healing of the birth trauma in whole is the grieving
Oh,
portion.
I love what you said, where we have to grieve what we didn't get to experience. That's, I think, again, a lot of women find themselves in the space where it's like, but shouldn't I be happy because I have a healthy baby? And everybody like tries to say the nice thing, and it's like, well, just be happy because you have this healthy baby and like you guys are healthy. And it comes from a good intention place.
Yeah.
But like you just said, it kind of brushes over that place of grieving and doesn't allow the woman to really be like, yes, obviously I'm happy that I have a healthy baby, but I'm also really sad that I didn't get X, Y, or Z, whatever their preferences are. And I think that
Yeah.
that's something that we need to do a better job at, like remembering that, like you said, maybe it's a NICU baby, maybe it's a C-section or whatever it is, and it's just like it's gone, and it's important to grieve that for sure.
Absolutely.
And one other,
And oh, go
oh,
ahead.
go ahead.
Oh,
Go ahead.
the other thing I was going to piggyback off of what you said is, when people make those comments, you're right. They're often, they mean well when they say that. Most people mean
Yeah.
well. I won't generalize. But you're right. Both can be true. We can hold both. We can hold the fact that we are extremely grateful for this baby and the fact that we experienced something very intense, overwhelming, and traumatic with bringing this baby into the world, right? Both can be true. And I think that really connects to honesty. We have to be honest with ourselves. If we experience, a traumatic birth, if we're not okay, we have to be honest if we're not okay. And I think it can be very easy to put our needs on the back burner when we have a baby, right? Of like, I'm just going to push through it. Everyone's telling me that you're okay, just be okay. I'm going to push through it. But there's a moment when we have to be honest with ourselves. I'm not okay. And I love that we're having this conversation right now because so many women, I think, walk around not okay, right? And we put on this facade, and we wear this mask and we push through for good reasons. Like, we know it's times where we feel like we just have to. But then there's other times where we come to the end of our rope and we do have to get the healing that we deserve and work through this trauma in a way that's going to help us to walk whole, in ourselves and not like just parts of ourselves or our broken selves, if that makes sense.
Yeah, for sure. And I mean, I also sometimes struggle with like the idea of martyrdom, where it's like, no, I'll just sacrifice myself so that everybody else can be happy and whatnot. But then I always have to remember to be like, but actually, if I'm not well, like mentally, physically, whatever, then my whole family's going to suffer. Versus if I had just put myself maybe first for 20 minutes, 25 minutes a day to exercise or eat or sleep or whatever it is, then I'm going to show up better. And then everybody else is going to be happier because I'm showing up better.
Yes, that's so true. And the way it's such an important point because the way that I frame that is around love. Love, you have to love yourself to be able to love others. And then when you love yourself, you treat other people, you show other people how to love you, right? Like, so such a, it's such an important piece that I think we sometimes brush to the side, but we do have to love ourselves in order to love our babies and love our families and love the other people who are important to us well.
Yeah, for sure. And I think that brings up another interesting point too, is that whenever I start working with clients, it's always beginning with like a tough birth or birth trauma that they want to work through. But then we usually end up like talking about so many other things, whether that be like childhood things that happen, self-esteem issues, like so much other stuff comes out because it's all connected. Like every single thing is connected. I think it's so cool.
Yes.
And then I just want to say one other thing too with the idea you mentioned about the birth plan, how you have your clients say like birth preferences. I think that is a great way to frame it. I also have whenever I have clients who are pregnant, I always try to get them to fill out what I call consent forms. So instead of like the birth plan, it's here's everything that I consent to, and here's everything that I'll need additional information to consent to, and like so on and so on. And it really does just give this different reframe to be like, yes, I consent to X, Y, and Z. I do not consent to this. And it's stuff that like isn't life or death or anything anyway. But I do think that that reframe is so important.
And I
So
like that because it helps to come from a place of like empowerment,
yeah,
just, walking through the door and knowing that you do have choices.
yeah,
Knowing that you do have choices, right? Like often, like we don't know that we do because, like I said, the hospital can be a very disempowering place, and it can be you have five different nurses. I mean, that's one thing I didn't realize until I gave birth was like you get attached to one nurse and then the next nurse is coming in and I'm like, wait, but
no,
I just got to know you and now someone else is here. And then, or if you're at a practice where you don't even know which doctor you're going to have that night to deliver your baby, right? It's like, it can be so anxiety provoking. So I love that you talked about consent, to know that we do have choices and we can come in knowing those choices
yeah,
and feeling empowered to communicate them.
yeah. I think it's so important. So you touched on this a little bit with the idea of signs that you might need extra help if you have experienced a traumatic birth, like um, maybe difficulty bonding with your baby. You mentioned like intense emotions, like different rage, guilt, shame, anger. I would also add probably just feeling off, like something isn't right, and you're like you can't put your finger on it, but like you just not aren't yourself, or like you feel like you just need a little bit of help to figure out like what is going on. Also, if you have any sort of intrusive thoughts or flashbacks about your birth, that's one thing that I had personally. I was terrified to fall asleep,
Yeah.
terrified. And then I would wake up after like 20 minutes and I would be drenched in sweat and I would like be so afraid I was bleeding to death and I would be so scared to fall back asleep because I'm like, well, what if I bleed to death in the middle of the night? Now, obviously, I've worked through all of that, but that is a really big one is that I personally suffered from was
Yeah.
those like intense flashbacks and like fears. But what other ones do you have?
Yeah, so I'm so glad you brought that up because the kind of like the intrusive thoughts, right? Those reoccurring unwanted memories that show up, bad dreams, nightmares, like you mentioned, flashbacks, as we've been talking about, where you feel like you're reliving the birth experience all over again. If you get upset when you're reminded about the birth, then that's a sign that you should, seek some more support. If you're feeling if you try to avoid thinking about it. So again, that avoidance piece, or even if you're not able to remember all the details of the birth, if it feels really spotty, right? Like that's that dissociation piece that we mentioned a bit there. And if there's any blaming yourself or blaming others that's showing up about for what happened during the birth, then that's something that could be a sign that you should process this a bit more. Or if you feel those strong negative emotions about the birth, so we talked about that fear, anger, shame, those are going to be some signs to get some extra support.
Yeah, I love that, especially
Mhm.
the one about if you forget parts of your birth, like they're just gone. That's something
Yes.
I see a lot. Sure.
That is a huge, yeah, that's a really important piece as well. And then, it's the others that you talked about feeling off, right? You said that feeling off, like losing interest in things that you usually, find joy in. If you're, um, if you're feeling like more negative about yourself, or just thinking about yourself more negatively, if you feel detached from people, detached from your baby, those are signs to, yeah, seek therapy or support.
Yeah, for sure. So
Mhm.
now just to touch on a little bit, like now that we've identified if we need any sort of additional help, how do we manage these different emotional triggers? Like honesty is a great one. So naming those emotions, saying like, I feel triggered right now and this is why. And that can really help you to either remove yourself or put yourself in a different mindset so that you can really like again work through whatever it is you're experiencing.
Yeah.
But what other like therapeutic approaches do you have, or any other ideas around how to manage those emotional triggers?
Yes. So, yeah, the first is definitely the honesty piece. And I'm just highlighting that because it's so easy to just brush it under the rug or just think that we can just kind of fight our way through it. But, when you've noticed all of those signs are happening to you, it's really important to put your needs first and love on yourself and get the support that you need to work through this because there's a lot of techniques like grounding techniques to kind of help with triggers in the moment, but we really want you to get to the roots of this, right? The reason that we get triggered in the first place is because, and I love a trauma therapist mentioned this, Gabor Mate talks about this, where it's like there's ammunition in us. That's why we're getting triggers, because we're carrying around ammunition inside of us, right? We wouldn't be triggered unless we're carrying something that can be triggered. And so we want to get to the root. That's something that at my practice, I'm really big on. I try not to I give my clients things to help them cope throughout the week, but we're really doing the work to get to the root of things. And so my biggest advice for dealing with the emotional triggers is getting connected with a trauma therapist, getting connected with someone who has that, perinatal mental health background. They don't have to have that, but it is nice to have that additional certification there. And then that's a PMHC to really get to the root of the trauma. And again, like I said, that's connecting the head, the heart, and the body. So in the trauma work, you should be talking about your somatic symptoms. So we talked about those physical reactions that you're having to these triggers. We're going to talk about the beliefs that now you're holding, if they're negative beliefs about yourself or about the birth. We're going to work through those things. And then also with the heart. So again, like we said, acknowledging those feelings, processing the grief, processing the loss that's attached to the birth trauma as well. All three of those layers are important to get to the root of the emotional triggers. And so Postpartum Support International is a resource that, I can share, and I'm sure you're familiar with that, Bridget, is there's free support groups for birth trauma through them, which I've referred clients to. And so there's resources that are for free for the community online to get into a birth trauma support group. And I think that's a great way to deal with the emotional triggers because it's so important to know you're not alone. And often women feel so alone when they're navigating, and we can't heal from trauma alone. We can't heal in isolation. I mean,